Good day! This topic is about trypanosomiasis and its treatment. In this presentation, we will be able to learn what is trypanosomiasis, species affected, transmission, clinical signs, trypanocidal drugs. So first, what is trypanosomiasis? Trypanosomes are protozoans, parasites in the family of Trypanosomatidae, transmitted by tsetse flies, also known as sleeping sickness. The three most important species is Trypanosoma congolens, Trypanosoma vivax, Trypanosoma brucei subspecies brucei. Species affected by trypanosomiasis: cattle, sheep, goats, pigs, camels, horses, donkeys, water buffalo, alpacas, llamas, dogs, cats, captive wild ungulates can be affected. Cattle are reservoir host for T. congolens, T. vivax, and T. brucei subspecies brucei. But other animals, including small ruminants, pigs, and some wildfire. Transmission of trypanosomiasis: tsetse flies, or Glossina spp, are its biological vectors. Affected animals can become chronic carriers. Transplacental and venereal transmission. Clinical signs: localized swelling caused by tsetse fly bite, intermittent fever, sign of anemia which includes pale mucous membranes, lethargy, lymphadenopathy, emaciation. Next, hyperglycemia may be seen in acute stage. And lastly, immunosuppression. What are the classifications of trypanocidal drugs? Aromatic diamidines, aminophenothiridine compounds, QUINAPYRAMINE compounds. Aromatic diamidines. Phenamidine produced strong effect on T. brucei and T. evansii. Stilbamidine and pentamidine used in human trypanosomiasis caused T. vivax. Pentanimidine is less toxic. Diminazine acetate is active against T. vivax, T. congolens, and T. brucei. Aminophenanthridium compounds. Homidium or ethidium, not active against T. evansii but trypanocidal in T. vivax, T. congolens, and T. brucei. Isometimidium or isomidium, trypanocidal against T. congolens and T. evansii. Its necrosis may occur at the site of injection. QUINAPYRAMINE compounds. First is antricide prosalt. It combines quinipyramine sulfate and quinipyramine chloride. It provides initial protection while chloride salts continues to provide protection after sulfate has disappeared. Suramine. It is highly effective against T. evansii, T. brucei, and T. equinum. Effective against T. congolens and T. vivax. Other trypanocidal drugs. Antimony potassium tartrate. Rarely used because of toxicity. Anthiomaline. Toxic but has less toxicity than antimony potassium tartrate. Lastly, trypan red and trypan blue. It is neither safe and nor effective. And that's all about trypanosomiasis and its treatment. Thank you.